Tracking and monitoring, it's important for a myriad of reasons. First of all patients, whether they're on high-dose opioids, whether they're on co-prescribed sedatives, there is a risk of adverse events to using these medications. And often these medications are not the best treatment for their chronic pain. So knowing who these patients are allows you to just know what's the universe of who is out there, who are on medications that could have these adverse events. Secondly, by having a tracking and monitoring system, you can identify specific patients who may be at the highest risk, because you really want to make sure you're tracking those patients and that they aren't falling between the cracks, because you've got a busy clinic. There are many competing priorities. Thirdly, by having a system in place, then you have a way to track your entire population. So you might have a population of patients that you can look at, like we were just talking about. You can look at differences in care across providers. You can track who are at the highest risk. You can look for those patients in between scheduled visits and understand what their needs are, and potentially, if you have population health managers in your organization, start to fill in some of the gaps of care. And by having a tracking and monitoring system, you can also see if you're making a difference with some of the activities that you're putting into place. So our clinic, what we have found when working with clinics is that they commonly take on a few activities as priorities. The first is, like I said, just finding out who are their patients on long-term opioid therapy. For many clinics, they didn't have an idea of who those patients are. So that's usually the first step. And many clinics also want to create kind of a dashboard of the key measures they want to look at for all of their patients on long-term opioid therapy. And I remember hearing last time that there may be a system for a dashboard in at least some of your clinics, or maybe all. And then, as I said before, you can use those data. The clinics like to use those data to monitor the care gaps, to identify their high-risk patients, and then track them specifically and look at clinical variation. So I'll just tell a story from a clinic that we worked with that was about to lose a provider that they knew had many, many clinics or many patients on long-term opioid therapy. And they also had an inkling, anecdotally, that the distribution of the existing patients with chronic pain was quite different across the providers. And they wanted to have a way to distribute the patients from this provider who was retiring to the other providers, but they didn't really know how to do that. So by identifying the patients by provider who had chronic pain and were on long-term opioid therapy, they could show to all of the providers kind of what the variation looked like. And then the providers could realize, oh my gosh, there's really some inequities here in terms of provider load. And they could try to distribute those patients in a more equitable way. And people were on board because they could see the data. So that was kind of that combination of story and data that would help the providers make a change. So we have resources for you all in terms of the tracking and monitoring systems on the website. And in the resource library, there's a section called Resources for Clinics, and it's divided into 3 sections: identifying patients, tracking and monitoring, and calculating morphine equivalency. I'll just point out a few of the resources there. So in the identifying patients section, there's a resource on what are the different kinds of approaches you could use to identifying patients. And that's when you're first trying to do so. Everything from using your electronic health record, to using the prescription monitoring program, to using lists that may already exist that providers are keeping. In the tracking and monitoring patient care area, we have resources on how to develop a tracking and monitoring dashboard. So tips for developing that, the kinds of variables, the data to consider tracking, the variables that you might consider using for care planning and measuring success. We have WSMA is the Washington State Medical Association opioid management dot phrases. So this is a way a resource that can help you develop electronic health record templates and workflows for opioid management. And finally, for sites that can't produce a dashboard using their electronic health record, we have a really simple Excel spreadsheet example that clinics could adapt to track and monitor the kinds of measures they want to look at. And finally, we have an excellent morphine equivalent dose calculator that's available through the state of Washington. So like Brooke presented for the policies and agreements and workflows, there are ways that practice facilitators can support this building block work on tracking and monitoring the sites. And in parentheses, after each of these activities, I've kind of laid out the roles that the practice facilitator is taking. So first, just helping a clinic launch their first tracking and monitoring process in preparation for that kickoff meeting where everyone is together to talk about the project and to assess where the clinic is at. So at that meeting, as Michael was saying earlier, oftentimes a clinical leader in the clinic will present some data and a story about where their clinic is at, why this work is important. So as a practice facilitator, you can share simple strategies for how to gather data before that kickoff so that the clinical leader has data to present. And then you can encourage that clinical champion or leader to report both the quantitative data as well as a story. And that can really launch that kickoff and show how important this work is at the clinic level. Secondly, as a practice facilitator, you'll be working with the opioid improvement team at each clinic. And oftentimes, because you have an electronic health record, there's this idea that you'll all of a sudden be able to get this fabulous data. And you may be able to do that, but sometimes it's not as easy as it looks. And so making sure to share the different approaches to gathering, tracking data, sharing simple tools if more sophisticated tools aren't available, encouraging starting small and then growing from there. So instead of having a full set of all the measures that a clinic might want, starting with 1 or 2 so that you can have early success. And making sure that the measures that you're recording and tracking and monitoring fit with the clinic's overall strategic priorities. So the clinic may be participating, say, in a quality initiative, and this could be part of that quality initiative. And that way, you're not going off in a new direction with these measures, but you're integrating these measures into an existing initiative that really supports the clinic's efforts overall. This really mirrors what Brooke was talking about of acknowledging the challenges. And I'd say in tracking and monitoring, this is especially important because extracting meaningful electronic health record data is challenging. We have heard so many times providers say, that's not right. Those data don't reflect what I really do. And there's a lot of grief around the fact that there are data in the electronic health record, but you can't get it out, or it's just really, really challenging. So it's important to acknowledge that data can be problematic. It's not perfect. And supporting the opioid improvement team and having conversations about how to use the data, acknowledge its limitations, think about which are the measures that really can reflect some level of reality in the clinic and following that. I think what's important is it's not the exact numbers that are always most important, but rather the conversations that folks have about the data. Like, okay, maybe these data aren't exactly right, but they may kind of point to an area that we need to work on. And so having those conversations is critical. I think the other thing that the 6 building blocks always encourages, and as a practice facilitator, it's important, is that this is really about the team. It's not about particular providers. For tracking and monitoring in particular, the entire clinical team is critical. So for example, it may be that medical assistants are actually entering a fair amount of the data that might be tracked in the electronic health record, not the provider. But the provider is also entering important data. And there's also an IT person who is critical. So there's an entire team involved in entering data and pulling data out of the electronic health record and making sure that that group thinks of itself as a team, shares strategies and ideas with each other for how to best track and monitor, what's important to track and monitor, those kinds of things. This kind of mirrors some other things that came up, making sure that as a practice facilitator, you're checking in regularly about tracking and monitoring because it is hard work. It can be put on the back burner sometimes. So, as a project manager, you want to check in with your clinics on how it's going. And as I mentioned before, encourage small steps so that you have early successes with a small area in tracking and monitoring and not try to do the whole thing. As a problem solver, you can work with the opioid improvement team. And in the in the resource library, in the resources for practice facilitators section, there's an obstacles and solutions document that shares actually for each of the building blocks obstacles that we have identified working with clinics that have come up in implementing each of these building blocks and the solutions that the clinics have come up with to address those. So using that document to support your ability to problem solve alongside the clinic. We'll make sure to ask for help from experienced 6 building blocks practice facilitators. And then you can also get ideas from fellow practice facilitators in shared learning calls. I've been really impressed just in this meeting, the sharing that's taken place, the ideas that have come up. That's really how for your organization you'll be able to cross kind of fertilize each other's areas of and solutions. Celebrating success, small and large, is really important as a practice facilitator. Asking the clinics to present their successes when they're sharing at shared learning calls, and then when you're meeting with clinics on a quarterly basis, bringing attention to success. And even as clinics, just presenting successes at your own meetings is incredibly important.